Well, I can tell you that generally speaking, in my practice, I have not seen uh, much in the way of dramatic pulmonary impairment in our COVID survivors. And in the literature that's been published, it's primarily been done on individuals who were in the hospital and oftentimes in the intensive care units uh, on ventilators, which of course is the minority of COVID patients, thankfully. And so, in that subset of patients, those that get really sick and have bad pneumonia and are on the ventilator, the studies do show that they have some abnormalities on their breathing tests, and there aren't they aren't the same kind of abnormalities that you see with emphysema, but they're you know something that could certainly affect your breathing. Now, the other thing that I'll say about this is that we've only had COVID for a year, so long-term effects, it's not hasn't been a long-term disease yet. So we don't really know. Most of these studies that are published were studies that were done at people 3 months after they had COVID. And so we really don't know a year later, 2 years later, whether people are still having respiratory problems. My instincts are that the lungs will heal for the majority of people. I think that staying away from cigarette smoke and other injuries that would hold back healing is important. I think it's deeply true. COVID is a new disease. They didn't teach us about this when I was in medical school. So we're all learning. I'm learning about it, and I've been, taking care of lung patients for 40 years. So we're still learning about it. There's new papers that come out in the medical literature every day, and so it's a new disease relatively. I mean, it's about a year old. So, we really don't know what it's going to do to people 2 years or 3 years after. Um, and I would guess that there probably will be some patients that have some permanent disability, but I think that that's the minority. I think most people are going to be okay after they recover from it as far as their lung function goes. The respiratory symptoms that COVID survivors have include uh, cough sometimes, fatigue sometimes. That can be quite prolonged for a month or two after the illness. And uh, there's not only been studies about the lung, there have been studies about the heart that show that in many patients, the heart is silently affected uh, by COVID, and that's something else that could potentially affect your breathing, and it wouldn't be detected on a pulmonary test. Um, you know, I see some of the patients that I saw in while in the hospital, but there are a lot of doctors and there's a lot of COVID, so I wouldn't say that I'm a central clearinghouse for all of those patients in any way. Uh, I would just say wear a mask, protect yourself. That's what I do. I do not want to get this virus, and I don't want you to get it either. I actually do think that our anti COVID measures have reduced the amount of flu that's being seen. And I think a lot of people are speculating that that's true.